and welcome to the New Europe Studios on Place Jourdan. I am Dan Alexe. With us today, Mr. Konstantinos Frouzis, who is head of the Association of the Pharmaceutical Industries in Greece, the so-called SFEE in Greek.
SFEE, yes. SFEE.
What does it mean?
Association of Pharmaceutical Companies.
And how does it sound? SFEE.
SFEE. SFEE.
Can you tell it in Greek?
Σύνδεσμος Φαρμακευτικών Επιχειρήσεων Ελλάδας.
I feel healed already.
Yeah, it's okay, don't worry, Dan.
So what is it exactly that you do as an association?
In this association, all pharmaceutical companies, either multinational or local ones, are participating in order to shape the environment. We need desperately in Greece a more predictable landscape, healthcare landscape, and we are all contributing there through a board of directors, membership, through a governance model in order to ensure with stakeholders, external stakeholders, government, politicians, commission.
Are you regulated by law or you have an internal table of rules and regulations?
No, we have internal regulations, very strict regulations, and of course we respect external regulations within Greece.
Do they exist at European level?
At Greek level first,
yeah.
But of course at European level is the overall,
And is there such an association in every EU country? Or?
Yes, there is an association and there is a mother association, let's say, in Brussels called FPA, European Federation of Pharmaceutical Companies.
The one that you came to visit now?
Yes,
and you just met this morning the head of this association?
Yes.
Richard
Bengstrom.
Yeah. And do the regulations differ very much from one country to another?
The essence of each regulation is to trying to shape a sustainable healthcare environment in each country for patients, as well as allow and unlock hurdles for the entrepreneurship. Of course, there's peculiarities by country.
Like what? Can you give an example?
Much more, foreseeable in the good sense environment in the northern European countries, more volatile,
they are more strict,
predictable,
yes.
But strict. On the other hand, in South Europe, as you imagine, it's more volatile, more shapeable.
Yeah, and you have fears of price fixing as well.
Of course, all countries. It's not a fear, it's a kind of rule, let's say, but we try to avoid to spill over from each country to another one the internal problems that we might have in a country. We try to contain our problems within the country.
But from the point of view of the common man, you have concrete examples that might justify the fear of price fixing. For instance, the price of some medicines against AIDS, let's say, or now Ebola, are so high, unjustifiably high. How can you explain this?
Listen, at the local level in Greece, we have a very easy mathematical equation where we reference the three lowest European prices among the 28 European members. So for us, it's a very easy equation. We have a very low, by definition, price referencing other low prices. So it's not Greece. It escapes, let's say, from this rule because we opted during the period of the crisis to have low prices in order to contribute to the savings in the country.
Can you compare this with the American market?
American market is much higher.
Much higher.
Much more inclined towards innovation. That's why the prices of innovative drugs are considerably high. On the other hand, the generic prices are very, very low. There are two opposites though.
And how are you affected by your contact with the state? Can the state influence you? Can the state force upon you some?
Of course, the state regulates first, legislates.
There has been a health reform in Greece recently.
Every year we're having, So for us, it's not a surprise. We are interacting regularly with the state. All board members are shaping a strategy in order to propose to the governments, to politicians, to the parliament, to opposition parties.
Yes.
We are all interacting, with them.
But speaking of the crisis, you must have been affected by this economic crisis.
Of course.
Because people cannot afford medicine anymore.
Considerably. First, the public spend from 5.5 billion euros in 2009 goes down this year in 2 billion, minus 64%.
It means the health services are affected.
Are affected, yes. The co-payment levels are increased for patients. The margins for all stakeholders, wholesalers, pharmacies, are considerably decreased. Everything is squeezed.
So it means that a doctor can deliver a recipe to a patient, but he cannot afford to pay for the medicine.
Yes, might happen.
Can you do anything for that? Your association?
In practical words,
you are just the producers, the industries.
Yes, the industries.
Not the services.
No, we are just the producers. Currently, what we're experiencing, we are delivering each year to the country, in the country, for the needs of the country, 2.6 billion euros drugs, and we are paid for 2 billion. So this means that 600 million euros, through rebates or clawbacks or discounts, whatever, are given, such as free drugs, somehow in the population.
And who pays for that?
Us.
The industry.
The industry. Yes. It's a very difficult financial situation.
Do you have an internal algorithm for spreading the risk, for covering the losses, or?
Each company contributes by its market share.
And how about waste? A lot of medicines get wasted every year. It's bad for the physical environment, and it's bad for the finances and for the people as well.
It's less and less, to be honest, less and less, because everything is squeezed, so the waste is decreasing
and
considerably.
People take old pills and all.
Old pills, yes, the unaffordable people mainly.
So, do you foresee any way out of this crisis in terms of immediate health of the people?
Listen, our purpose is how we, during this crisis, how to maintain patients' access to therapies. This was our duty as industry and as stakeholders, including physicians, pharmacists, whatever. I think that at least we tried and we managed to maintain a quite affordable level of access for patients, although now the situation is very critical. This is a turning point, let's say, because a lot of uninsured population is in Greece after all this kind of jobless rate soaring. And that's why we need to be very cautious when the government, for instance, is shaping the budget for 2015. We are there to discuss with them how to make it more affordable for the industry, but mainly for patients and citizens.
You've been head of this association through many governments. Could you feel a difference between a left and a right-oriented government in terms of health, public health?
I think that more and more all governments are more social driven because they need to maintain a social cohesion, and at the same time to try to support development in Greece, which is critical for the rebound of the Greek economy. I tend to think that leftist parties are more inclined to support citizens in this sense.
They have to justify their ideologies.
Yes,
How long have you been head of the association?
Almost 3 years now.
3 years. What was your, let's say, worst moment?
Worst moment? I might think that it was before 2-3 years that we had experiencing the dilemma between drachma and euro, a very uncertain period for Greece and for pharma industry. All companies were making.
The drachma was shed more than 10 years ago.
Yes, but
the effect
we
came
might.
later?
Yes, we might have a reverse from euro to drachma if ever the bankruptcy.
Yes.
were
the dramatic future.
Dramatic, yes. We avoided as a country, but at this point of time, I remember myself and my colleagues in other companies in Greece experiencing very difficult times how to maintain their investments, their products, their employment. it was very critical for the whole country and for pharmaceutical industry also.
And what was your best moment?
The best moment, I think, that is we escaped from this, and we are.
You felt that you escaped?
I think that we escaped. Of course, crisis is still here in Greece, but it's a different crisis. We need to be, we now have costs at a very low level, and we need to be very clever enough in order to allocate resources to the right, expenses, cost centers.
How many health ministers have you met?
Almost 8 years, 7 ministers.
7. And did you feel any difference between their?
To be honest, 1 year almost per minister, or 15 months per minister. It's not the ideal for a guy to make the job correctly.
Right.
And,
you are also co-president of Novartis.
I'm vice president. Vice president. Yes.
How can you conciliate the two positions?
All guys from companies have a duty to participate almost in this association, because it's a kind of contribution. We are there to, along together, to shape the environment and to protect, let's say, our industry, the patients, the investments. It's a kind of duty, I think. We need to devote time. It's difficult to balance company and association for all guys of the board. But we need to do it, and we are doing this.
Do you foresee a future with a healthier population, a healthier planet, people who would live longer, be more healthy, less diseases?
I think almost every year we are gaining some days of lifespan, because of the medicines, of therapies. The last 40 years, if I'm not wrong, we gained 10 years of prolongation. It's very considerable. So I think that as industry, our duty is to prolong, and we are doing quite well this, as long as the governments around the planet is giving the necessary, let's say, investments for healthcare to the citizens. And we are there to, let's say, to urge the governments to participate in this healthcare, revolution, I would say.
But then you would go bankrupt.
I don't think so. I don't think so.
We'll always have the hangover.
Yes.
Cure.
You're right. You are right. But we have also the sense of stop if we overdo it.
Mr. Frouzis, thank you.
Thank you very much.
We had with us Mr. Konstantinos Frouzis, head of the association, the Greek Association of Pharmaceutical Industries. Thank you, Mr. Frouzis.
Thank you very much. Thank you.
I am Dan Alexe. This is the New Europe Studios on Place Jourdan. Thank you for being with us.